Okay, let's look at a health assessment of our thoracic and lumbar spine. We're going to start off with a thoracic CARS, a controlled articular rotation. Legs apart, breathe in and irradiate, and what we're going to do is make the biggest circle possible we can in the pain-free range, and we're looking at what movement you have ownership over. So we breathe in and irradiate, we come down into flexion of our neck and our thoracic spine, we find our end range. We don't want to be flexing from the hips here, and then what we do is we go into rotation, lateral flexion. We search for that best possible range of motion. Coming into extension, rotation, laterally bending, and then coming in to flexion again. So what we want to do is take pictures of our lateral flexion, flexion and extension, so we can get an idea of where we're at with that movement. So we come to the side, we breathe in and irradiate. Again, come into the best possible flexion that we can with our spine, and that would be where we would take the picture. Coming into lateral flexion to the right, we then come in to flexion, lateral flexion, going into that the best we can, and we'll take a picture there. We'll then go into extension, so coming in and around. As we come into extension, we would take a picture there. Okay, let's get into doing some spinal segmentation work. Let's video this, and we just want to really focus, really slow and controlled. We're going to go individually up the spine, initiating flexion and extension. See if we can see that wave there. See if we can see areas of our spine that we need to work on where the mobility health is not good. So if I demonstrate this, let's breathe in and irradiate. Let's get into that extension first of all, and then we initiate from our lower back. We want to initiate lumbar, and then we go up vertebra by vertebra, up into our thoracic spine, and then we flex the neck, looking down towards our knees. Let's initiate from now my lumbar spine into extension, slow and controlled, going up the spine, and then my neck into extension. So observe that when you do that video and see if you're getting a nice wave through your spine. Observe if there's blocks of vertebra making that movement. You'll probably notice that my thoracic spine is what I've got to be working on, and that's what we can focus our mobility work on and our functional range conditioning. So assess yourself, see how you're going, and then focus on those areas. Well done.